Health Committee meeting to order at 1 o'clock. Councilor Taylor, would you do the invocation?
I would. Heavenly Father, we thank you for this day, for bringing us safely here. We pray that you will be with us, guide our speech, guide our decisions, that they will glorify you. We pray for the servicemen, both here and abroad, standing in the gap for our safety, that you will put a hedge of protection around them today. For it's in your name we pray. Amen.
Amen. Shelley, would you do roll call, please?
Target,
Present.
Brian Word,
Honey.
Bill England,
Honey.
Keith Austin,
Here.
Jack Baker,
Here.
Harley Buzzard,
Here.
Joe Bird,
Honey.
Sean Crittenden, John Garvin, Wanda Hatfield, James Jordan,
Here.
Dick Lay, Curtis Snell, Denise Taylor,
Here.
David Thornton,
Honey.
Victoria Vesquez, David Walkinston. You have a quorum.
Okay. Need approval of the minutes of December 12th and of January 16th. Motion. Second. All in favor? Aye. Okay, we'll move on down to reports. First is Claremore Service Unit. Mr. George.
George is all right.
Good afternoon.
Good afternoon.
In addition to what you should have there in front of you, I want to tell you about, we have a couple of construction projects going on. We're renovating one of the X-ray rooms. We've taken out all the X-ray equipment and we're converting that to a room to do some cardiology studies for the cardiologist that comes up from OSU. And we're going to move the excuse me, the echo machine. We'll do echoes in that room. That's coming along. We also have some renovation projects in the surgery clinic and women's clinic. Both of those are to add additional exam rooms to accommodate the patients. We are due for a survey that sometime, actually it expires February of 18, but we are actually due for survey. They can show up anytime between now and then. As you well know, Joint Commission's surveys are unannounced. So, we've started preparing for that. And then, excuse me, Friday, once again, I met with Dr. Lang and I met with the Hillcrest officials there in Claremore to discuss hopefully the last, it'll be the last meeting on the orthopedic contract. We're still trying to get that approved, and what we talked about Friday, of course, we'll have to go to their attorneys for approval, but we're hopeful that we can get this through and done quickly, and quickly is kind of a loose term here, but we're still working on it. Any questions?
Okay, any questions? Councilor Austin?
Yes. George, I had a member of the community contact me, and his concern was that as a Cherokee-speaking elder, as his first language, that he has a really hard time understanding the big words the doctors use.
Mm-hmm.
And while I suspect you have a way of dealing with that, but I'm not sure that the patients always know that there's a way of dealing with that. Can you explain to me how that may work?
I'm actually glad you brought that up, because one of the conditions of our accreditation through the Joint Commission is to have interpreters for second languages or first languages in this case. Sign languages and Spanish interpreters, they have competencies that you could take for that. And one of the things that's always kind of been a roadblock to us is before we've had Cherokee speakers that work there, and they could step in and translate and for us. We're getting to the point that we only have one or two there now. And I was actually told that we called down to see if there was a speakers list, an interpreters list, some type of thing that we could work with. Now, I don't know exactly who they called down here, but but I was told that they were told, no, there isn't anyone to work with. There's no type of interpreter list or anything like that. I would be very interested in putting together a list of speakers that we could call, put on call and put a contract in place with for that very service, if that is available here.
Well, we were told that we do have people available for that by our language resources, so we'll have to get our language resources people to contact you.
Get with me and we can work that, we get together and work that out.
Okay.
By all means, absolutely.
Thank you.
Thank you.
Okay, Counselor Taylor?
Who would be the contact at the hospital that we should put them in touch with?
Either myself or Christine Gillum. Gilliam. She is the survey readiness officer. She can be reached at 918-342-6434. That's the administrative number, and they can get you in contact with her.
Because I think there's probably just a breakdown in communication
Okay.
there, because we did discuss that the last time.
Yes. Thank you.
Counselor Critton?
Yeah, just while we're on this, I know, talked to Dr. Stalk up here a little bit, but I appreciated Counselor Austin bringing that up last time, because in my area, I've had in fact, an elder a couple of weeks ago called me after we had that discussion about someone in place in the clinics, and I'm finding out I'm not a job creator, but I'd like to get with the committee. This was a sincere elder that, similar to what Counselor Austin was saying, she sometimes just feels lost. And my simple brain has just a desk up there, might even say elder assistants, and even go in there with the doctor or nurse, and but I'd sure like to look into that pretty seriously, and I think everybody would. Just someone there, 2 or 3 people at the least, just there, an elder can depend on them. But
I agree, that's a good idea, kind of an advocate to go in and...
yes, sir. And but I just wanted to mention that while we was on the subject. Thank you.
Any other questions or comments? Thank you, George.
Thank you.
We'll move on to the Cherokee Nation Health Services. Looks like it's Mr. Bryan.
Good afternoon. I'll be representing Health Services today. I think all of you have the report in front of you, and I'll hit a few highlights and then answer any questions that you may have. First of all, I want to thank all of you for your support with the joint venture on the Outpatient Health Center, and thank those of you who were able to come out and support us at the groundbreaking on Friday. As you can see from the report, our revenues are continuing to increase, patient access is continuing to improve, and that is our number one focus, which is improving access to patient care. We talked about the groundbreaking, and then we do have a recruitment report I want to go over with you, remind all of you about the RDocs Rock event that's coming up. I hope that you're able to attend that. That's going to be on May 20th at 6 p.m. at the Hard Rock in the Sky Room. So we sure would like to see all of you there. Attend that with our physicians and advanced providers. As you can see, we continue to work on improving recruitment efforts, also our retention efforts. Councilor Hargis, you'd asked us to look at improving the vending space and break space at Mankiller. We're working on doing that in the area that's going to be remodeled soon. Also, along the same lines of retaining and recruiting our physician providers, we have remodeled our anesthesia office, and that also benefits the patients. They have a better place to do their pre-anesthesia evaluation. And we're currently in the midst of remodeling the medical staff library to make that a lot more aesthetically pleasing and comfortable for our physicians. Be happy to answer any questions that the committee has.
Any other questions or comments? Counselor Baker?
Yes, I actually have a couple of different items.
Okay.
First of all, the Cherokee Elder Care, those are Cherokee Nation employees, is that correct?
Yes, sir.
Okay, because I know their pay stub shows that they're Cherokee Nation employees, but yet they do not receive a Christmas bonus.
They are employed by Cherokee Nation, but I believe it's a different LLC. It's a Cherokee Nation LLC, I believe, but I can look into that and find out.
But I would think if they're a Cherokee Nation employee, they should still be eligible for our Christmas bonuses
Okay.
that we've appropriated money for.
I'll have to get you an answer on that, sir.
And the other item is, I'd stopped by the Three Rivers Health Clinic for new glasses last week. And it was like 2 o'clock in the afternoon, and the doctors told me that they'd had 3 cancellations just that afternoon, or no-shows, I should say, at 2 o'clock. And they said that if we could go back and implement the automatic call to remind people of patients, that it would certainly help them out because they're wasting a lot of time, that they could see a lot more people if it wasn't for all the no-shows. And right now, they're only accepting appointments for 2018. And yet they could fill a lot of those if they didn't have the no-shows.
I don't know what they do in the optometry department at Muskogee. I know that most of our clinics have adopted what they call a 3 Cs model, where the patient gets a call, a confirmation, and a card, trying to decrease the no-show rate, because the no-show rate across our facilities takes away a lot of access. The efforts that we've implemented at Hastings, I can say, have helped with that, and I'll work with optometry on that as well.
Okay, right, because right now, nothing's being done.
Okay.
Appreciate that.
Yes,
Thank
sir.
you.
Counselor Taylor?
I just had a question about the pilot program for the screening of colonoscopies that was held in December. Can you expound on that just a little bit? What are you doing differently? What was the scope of that operation?
So we have a fairly lengthy waiting list for colonoscopies, for screening colonoscopies. So in order to work on that waiting list, we have a group that meets every Monday of leadership from surgery, meeting with the executive team at the hospital. And one of the ideas was to come in and work on Saturday. So we had an anesthesia provider, our surgeon, as well as our surgery crew come in and just worked on Saturday, trying to do as many screening colonoscopies as they could in that day. And we also tried to keep it people that were fairly healthy, so that we could do them quickly and safely. And so we've done 2 of those Saturday scope days, and just working on decreasing the waiting list. And I would say it was a good success, but we're also working on our scheduling practices Monday through Friday to try and improve access there, so we don't have to bring in a full team on Saturday routinely.
So it was just an attempt to kind of work through that
Backlog.
of
Yes, ma'am.
colonoscopies. Okay, good job.
Thank you.
That's all I have.
Counselor Buzzard?
Yeah, thank you. I've got a couple of things here, Brian. And the first one is our behavioral health department there at Hastings and throughout our clinic areas. Got the ASI Severity Addiction Severity Index. Apparently this guy tells me it takes 2 days training and takes about 2 hours to complete those indexes. But he also makes a statement that they're being just outrun in patients from the Northern District, I guess because we don't have those mental health service workers up there. He also tells me that there were 2 of the people trained to administer those ASIs and telequal, but they're no longer doing it, not allowed to do it. I just need you to check into this and see what's going on. The other thing that I'm being told says the emphasis is on quantity, seemingly without regard to quality or the outcomes. More or less, they've just been shoving through the system and not the numbers up is what he's saying, or what they're saying. He said generally those tests take 2 hours a day. So he says with their scheduling, they already were filled up, but now they're getting pushed to do more. The other thing he brought to my attention was in the past, he says that we, Cherokee Nation, had always encouraged training. More or less the training has stopped. They don't get to do much training anymore. So if you would, Brian, check on that for us and see what kind of training they're offered. I don't know, it seemed like his feeling was that we were tying his hands of what they could do as far as being a social worker. The other thing that really disturbed me, that we had already depleted fiscal year 2017 allocated at $226,000 for inpatient. That's what the budget was. And here we're just barely 6 months into the budget season. I was also told that we had spent $3 million in 2016 in this department. So you might want to check those numbers, because there's always two sides to every story.
Okay.
I'm just telling you what I'm hearing. And he says this is 9% less than previous years what the expenditures were for patients in 2017. So it's a big difference in what we're spending in mental health. This came to me, and I guess I'm just a messenger, but it does disturb me to hear these things. It seemed to me like it's almost what they were saying is we want to control too much in Tahlequah. Not have our clinics to have a say on what they can do in some of those clinics as far as scheduling. Now, I'm familiar with Jay because that's the county and the clinic that I'm familiar with. And we don't have a worker up there yet. I was told that we take care of that, but what they do is bring workers from Salina or No Water and put them in Jay for a day or two. But that's not working well. Had a guy from Uchi went to Tahlequah to get his test. Well, he couldn't do it here because it didn't have one of those people that administer the test, and they sent him to Salina. Well, that just threw them in more of a scheduling conflict. So I'd appreciate it if you would check, and I would even pull some of the people that schedules and things like that to see what the scheduling is, because I only know what I'm telling you.
Okay.
Okay? The other thing is I want to bring to your attention is the audiologist there at Hastings. I was there the other day and I went in and got a hearing test. And the guy, and he's actually a civil service employee because he had on a uniform. And he was answering the telephone. He was scheduling. He was doing the test. And I said, "What are you doing all this for?" He said, "Well, I'm the only one here. Can you check and see, or why is it?"
He had an assistant, and the assistant is no longer with us, and we're working
Okay.
to find a replacement. And we've been trying to give him some clerical support from another department, but it doesn't always work for him. So,
Right. Well, that kind of shocked me when we have a guy with his background doing that and doing hearing aid tests and
Yes,
stuff like that, and have to schedule, and then having assistants to do things that the assistant can do that he
Right.
should be doing something else. So anyway, I just want to bring that to your attention. It sounded to me like you already were.
Yes, sir.
So, I appreciate it. Okay. Thank you, Madam Chair.
Counselor Garvin?
Yes, thank you. I need to visit with you privately after the meeting.
okay.
Is that all? Okay. Counselor Lay?
Thank you, Madam Chair. This is your day, Brian.
Yes, sir.
And I'm noticing here, on the roster, actually it's called Rooster, but I'm sure it's roster. But on the vacancies of the clinic at Ochaleta, we were showing one vacancy. Actually, there's two because we don't have, Dr. Gray is actually at Salina, he's filling in. And some of these other clinics, I noticed we've got two. Will Rogers at No Water, there's two. That's actually three because Dr. Gray is just filling in. And I think there's some locum tenens working those, but on some of these clinics, we're like 50 to 75% down in physicians, it appears to me, just running the numbers here. And so I hate to beat a dead horse, but I'm gonna do it one more day.
All right.
If somebody could pull a doctor out of the hat or a rabbit out of the hat or something, we need a little help here.
We have people working to try and get those vacancies filled, but some of the locations are hard to get physicians to go to. But we're continuing to work on filling them.
That's not what I wanted to hear.
Yes, I understand. We're doing the best. I can assure you that our recruiting staff are doing everything they can. Dr. Stalkup's working, Dr. Smallwood's working to try and get people into these spots.
Thank you.
Yes, sir.
Counselor Thornton?
Yes, with this dilemma we had on mail order prescriptions, where are we at on that right now? Getting better, worse, or?
I believe they're getting the system back online, the central refill center. Is that what you're referring to? Okay. I believe they're getting that system repaired and back online. Jeff is working
They did a good job with it off the line.
Yeah. It took a lot of resources to keep that up. Yes,
They
sir.
worked a few hours extra, but they did a good job down at Redbird now. I don't know about anywhere else, but I know I'd phoned in the week with that. I had that dilemma. They had my prescription waiting down at the Redbird, so they sent everything into the different clinics, and they filled them at the clinics. But they did a pretty good job.
Appreciate that.
Thank you.
Yes, sir.
Did you have something, Sean?
Yeah, just a couple of quick questions. My phone is, never seen one like it. It's too much information, but it's jumping around like somebody's poking. I can't get it to pull up. I had one here. Let me pull this up real quick. No. Well, I'll just go to the other. One of the questions, Brian, I was hoping Connie was here. We just make a note, have her email me. Had a complaint about at Hastings, I believe, and it was a good family that just don't go around making things up. They're good people, and I seen where she had responded to them. And I was just going to get a follow-up if I could.
We've called that family, and I'll be happy to share more with you.
Okay. And I had a question. Now, right now, we just have one audiologist, right?
That's correct.
And highly recruited, I guess.
They are difficult to find. What's more difficult is we only have one sound booth. And so we're working on getting another exam room so that we can have two audiologists and keep them both actively engaged in doing audiology type work. But with only one sound booth, that's the rate limiting factor on a lot of their work.
Oh, that's one in the entire Cherokee Nation.
Yes, sir.
And the joint venture, is that
It'll have
planned?
additional audiologists and their booths.
Okay, additional. Okay.
Yes, sir.
And one other thing, I talked to Dr. Stallcup. He's really good about meeting individual situation. Really good about getting back to me. And he met the one about the eye exams and said that we're booked up until November. And is that pretty much the?
I would say that continues to be the case, but I'll defer to Dr. Stallcup for specifics.
So I followed up on that. I'm sorry, Mr. Crittenden, for not getting back with you. So I'd actually talked to Dr. Lighthizer. We have an issue now where for well vision checks, they just don't have enough optometrists to do them all. This is a problem. This is something that we're going to address. No matter what we have to do, we don't want people waiting for well vision checks. We want to, as part of that, you hear me talk about customer service all the time. It's part of the customer service. It's not good enough to do part of it, but only the sick exams. We want to do everything. So they've had this sort of, it's not a great way to do it, but what they do is you call in during a certain time, and then they only book those exams out for a month. Now, that's not enough to serve everybody, but you're pretty much guaranteed that everybody who gets booked will show up for that month. Well, they had a couple of our clinics, their specialty in our clinics that said, well, we're getting some complaints about that, so we'll just open up the calendar and start booking them out to whenever. Well, unfortunately, within about a week, it ran out over a year. And so I did follow up with Dr. Lighthizer, and I told him, I said, the no-show rate a year from now is going to be about 70 or 80%. And everybody who has the availability of going somewhere else to get it done is going to get it done privately. So let's kind of reel that back in. And he assured me that he was going to meet with his folks and get that scheduling solved. But I'm really sorry that people had to go through that. That was certainly not our guidance or our intent.
Yeah, well, they were extremely happy when I got back with the family.
Okay, good.
That situation, but I know know you're on it, and November just sounds like a ways away.
I was a little bit shocked, and then I called him, and he kind of confirmed that, and I was even more shocked. So I'm sorry about that, but I do believe that we've gotten that fixed, not only there but all the sites.
Appreciate it. Thank you.
Counselor Taylor.
So we have been told in this committee numerous times that joints are elective. No knees, no hips, shoulders, that sort of thing. So I had a call last week from somebody that needs double knee replacement. She has done her everything from start to go within our system. Our orthopedic surgeon scheduled her for knee replacement. Why are our doctors scheduling patients for procedures we're not going to cover?
I don't have a great answer for that. I'd have to look at that specific case. Okay.
Thank you.
Counselor Walking Stick.
The joint venture,
Yes, sir.
are you familiar with some of the expenditures, the allowable expenditures on this joint venture?
I'm not sure I know what you're referring to, Counselor Walking Stick.
The $80 million,
Okay.
do you know what the allowable expenditures are on the $80 million?
It's for staffing and for operating expenses.
Okay. I'm going to break this down into staffing, see if like a behavioral health would that fall under the staffing?
I believe so, yes, sir.
Okay. All right. That's all I want to know. The next thing is I know last week we talked about some customer service to our employees about treatment good, and some of the doctors called me and said that after our meeting there was a witch hunt for the person in the group that talked to who was it that talked to the council member, and so they, again, what kind of climate are we trying to create in the workforce? And I don't know if you guys get phone calls, because I get them all the time, and I might be the only one that's addressing them. You guys may get phone calls, and I'm just putting them out there, and people may be using me. I don't know. But the thing is that's the perception and they're feeling in the workplace is they're insecure. And I don't know how to change that, but you guys do, and if you guys could create an atmosphere of safety, I don't know how you go about doing that.
Well, we are doing customer service training with all of our staff right now, and that also focuses on, we believe that you have three customers, right? Mm-hmm. The patients, the physicians, and each other, the staff. And so I think as we focus on customer service, it'll help some of that. I would point out that we have a very low turnover rate with our employees. And then also, as you can see in the report, we've increased access. And that's additional work. That's work that this system has not been doing before. And so there's going to be some discomfort as we increase access to patient care. Yeah. But we do want to try and make sure that everyone feels safe and secure in their jobs.
And this is Hastings, by the way. This isn't your office clinic. This is Hastings Hospital.
Okay.
Just take it for what it is, and maybe bring everyone together and say, this is how we're doing things. We're not vindictive. It's a safe place.
If that's Hastings, then I'm not aware of the situation that you're referring to.
Well, we visited about it last month.
Okay.
In the committee with Connie.
Okay.
So, anyways, but that's all I have for that. All right, thank you, Chair.
Councilor Crittenton, Jim.
Yes, ma'am. Found my question, one of them. Lady was, when did we quit giving out printout of everything that was done that day? And I'm not familiar with that, thank the good Lord. But did they used to give them their printout?
Yes, sir.
And now they don't?
I believe we still do. I still see patients receiving those, and
they
should still be getting them.
If someone's telling this lady that they can't, then
we need to know about that.
Okay. All right. Well, thank you. Back to the eye clinic. got a guy, Chewy area, needing a referral for his eye. And Brett, was that one of them that you was gonna get with me about? Okay, all right. Well, I'll just talk to you in just a minute. Thank you.
Counselor Buzzard?
Yes, Brian, I just want to follow up on what Council Lady talked about on referrals a while ago, and that seemed to be a problem, all right. It came from ortho that they just scheduled this guy to do some knee work. And so he just assumed they made the appointments for him and everything, so he goes down and gets the knee work, gets it worked on, and then all of a sudden he finds out that he didn't have a referral. Although they set the appointments up and did everything, he hadn't got it, and he didn't have a referral. So now he's stuck with, he had insurance luckily, but it paid most of it, but he still had to deduct the 20%, which is a considerable amount of money. But he just assumed that once they made the appointments for him and told him, you be down here for pre-op, and here's your surgery day, that everything was taken care of, and it wasn't. It just...
Well, with the overwhelming majority of them, it is taken care of. If you'll tell me that patient's name later, then I'll try to pursue that.
Now he's stuck with a bill, and he thought, well, I thought everything was done, but I think just some communication needs it. Anytime you go to a doctor or someplace, make sure you've got that referral in hand or something, because sometimes people think, well, we'll set it up, or, well, that's what he thought. It was scheduled for pre-op, and the surgery was set up, and he just assumed that he had a referral done.
Well, he should have. They have a checklist that they go through.
Yeah.
They're supposed to ensure that they have all that in place, so.
Yeah, well, anyway, let's follow up on it if you would, but yeah, I'll get with you. The other thing, I just want to answer Councilor Walkenstick. Yes, we get, or I get calls like that, Councilor Walkenstick, because that's what I was talking about on mental health a while ago, so, yeah, I'm sure we all do. Anyway, thank you, Madam Chair.
Counselor Byrd?
Yes, automatic calls. Is that something that we are doing, or we discontinued those?
So when we switched our electronic health records, that ability went away. We're currently waiting on approval of a purchase order that will reinstitute that and also add text messaging to it as well. So we're going to be a lot better off once we get that approved.
Okay. Well, these referrals, or most of these referrals that we're talking about here, are they people with insurance? Could you break that down on how that's being handled? Because
to answer that definitively, I'd probably need to get back to you.
Okay.
I would assume so, but.
Okay. And then the language barriers we were talking about, our clinics, we usually have a liaison there, an advocate in most of those clinics that I'm familiar with. For sure, Hastings, is that correct?
Yes, sir.
Okay. If not, we can always talk to Ron Etheridge, Education Department, Rob Darty, Community Outreach. One of those agencies will have somebody they can send out there, so we can address that, okay?
Yes, sir.
Thank you, Madam Chair.
Any other questions or comments? Yes, not. Thank you.
Thank you all.
Okay.
And good job Friday on your staff.
All right. Thank you. Appreciate that.
There you go, Brian.
There's old business, none pending, new business, none pending. Any announcements? Okay, next meeting is tentatively scheduled for Monday, March 13th at 1 p.m. Need a motion to adjourn? Second motion, second. All in favor? Aye. We're adjourned.